Speaking of looking at the disease, you brought a wonderful little show and tell piece. Do you want to tell us? We've been talking about the coronavirus now for 10 months or something, and we don't really know what we're talking about, most of us.
Well, you see this symbol in almost everything now. We're just talking about it's on every pumpkin this year. This is what it looks like. This is this coronavirus. It's a spherical virus, but it has these spike proteins on the surface, which are really important because they're the ones that enable this virus to get inside your cells. That spike protein finds a match in a protein on your cells called ACE2, and that lets it jump into the cell and start copying itself like crazy. So what do we want to do in terms of developing a vaccine? You want to get a way for your immune system to make antibodies that will attach to those spikes, like, chewing gum stuck all over them, and keep them from being able to get into your cells. That's what we're trying to do. So all the vaccines are basically trying to raise antibodies against these spike proteins. This is a fancy version where the spike proteins have two different colors because they have sort of an open and a closed configuration. That's a fine point. But basically, it's those spike proteins that we are all trying to immunize against, and which looks like it's working pretty well, at least with the first one or two out of the gate.